All right, everyone. Welcome once again to the Faces of Business. I am your host, Damon Pistolka, and I am very excited for our guest today. If my microphone doesn't fall off and hit me again, but we have Sarjoo Patel from Teams or Beam Healthcare. I was looking to think of one of your other companies, Beam Healthcare. This here today, we're going to be talking about perseverance and transformation of healthcare because he's been doing some great things. Sarjoo, thanks for being here today.
Appreciate you having me.
Yeah. Well, as we always like to do, we'd like our guests to tell us kind of how you got into what you're doing today. You've got a varied background between, of course, you're an MD and that, but you also got a business background and actually an operations management and information systems. So this is an interesting background for you to be doing what you're doing. So it'd be cool to hear about how you got into doing what you're doing.
Yeah, no, it sounds good. So, yeah, I had zero intention of going into healthcare or medicine in general. Like that was just never in my roadmap. And I was in a business school enjoying it. And yeah, the major was called, Operation Management Information System or OMIS, and enjoyed it. And during my senior year, just had a few personal things that ended up happening from family and friends perspective. Lost a couple of folks, unfortunately. And the providers had a lot of impact on myself and my family members. And I just, from my perspective, just thought that would be the direct way I want to have a community impact. And that's really when I decided to pursue healthcare. So I was in my senior year and decided I'm going to graduate and go into healthcare. So I was working, while doing some basic science classes, etc. But that's where it all started.
Wow. So personal experience, you decide it's time to go into medicine. So you start down the road into medicine. I mean, that's after you're that far down your educational highway already. Was it tough to kind of switch gears and go into medicine?
Not for me personally, because to me, I mean, that is what I wanted to do, and I was
Okay.
fixed. I was fixed on that. So, but the thing is, when I actually told my parents, I kind of surprised them. I made a visit to India and kind of surprised them, saying, "Hey, this is what I'm going to be doing." They first of all weren't even expecting me at their front door. And
Oh,
the first thing they asked is like, "Are you doing this for us? Because we don't need you to become another Indian doctor, right?"
yeah.
So I'm like, no, I'm doing this for me. So I personally never questioned it. And honestly, I
Very
actually
cool.
never thought about the 7 years, 11 years, or whatever. It's just, yeah, honestly, I never questioned it personally.
Yeah. Wow. So you started being a doctor. What were some of the things that you really learned early in your career as an MD that kind of shaped what you're working into today with Beam Healthcare?
Yeah, and good question. So, I graduated in 2011. I was a chief resident in my residency. So I always were like, even in medical school, I was, like the president, and always did a lot of operational in terms of and the management or just evolving in different programs, right? But when I graduated, I was hired at a rural hospital to be their medical director. And I'm very thankful for them. And, they gave me the start. And as soon as I started, created their program for the hospital side, which was to improve just overall patient care locally, right? Avoid unnecessary transfers and those kind of things, which we were able to do. But honestly, it took me probably about a month and a half to realize that, hey, I come from a business and an efficiency sector, and then I'm working in one of the most inefficient sectors. And to me, healthcare is simple, but unfortunately, we've just made it complicated. So, I thought maybe there's a better way of doing this, and that's really where the idea came about for Beam Healthcare, which is, can we leverage very few simple things, right? Number one, can we leverage technology like telemedicine to provide better access? So that was one. And when I say better access, meaning to specialists or even your primary side, doesn't
Yeah.
matter. Second was, in the rural communities, a lot of times you see doctors come and go, right? Or they do some short gigs or whatnot.
Yep.
can we build a team that's truly dedicated to changing healthcare and that's, full-time, part-time employees versus just doing gig kind of work? So team was the other piece in this, right? So technology was one, people were the other one, and the third one was operational efficiency. Meaning, if we want to scale, if we're just doing the status quo paper pushing, is not going to work. Especially
Mhm.
in healthcare, where you're trying to manage multiple providers, multiple different licenses, multiple different entities. So we started as a paperless company from day zero. Uh,
Ooh, God.
but I think one thing I should mention, these all these things were great on paper. It took me about 2 years to get a yes. Because remember, majority of the conversations keep going back towards, "Hey, is insurance going to pay for it?" And the whole thing was the whole concept needed to be in, even if you get $0 from an insurance, right? How can you leverage all of these things to retain more folks, right? Increase the capacity of what you're able to, or capability of what you're able to do into the types of sicker patients you're able to take care of now with team-based care approach.
Yeah.
Yeah, that took me about 2 years to get approved. I mean, I got plenty of no's, from, various folks, and I completely
Yeah.
understand their reasons.
So when you say approved, was this you were still with the organization and for them to allow you to go out and try some of this stuff or?
Yeah, yeah, so initially, I was an employed physician, and they were, very supportive of all of this down the road, and, they let me transition to my own company, and then they were actually thankfully, they were, our first pilot program,
Wow,
10 years plus later, they're still with us.
that's cool. That's cool. So when let's go back to the beginning. You talked about healthcare is one of the most inefficient industries. So, what are some of the examples that you saw early on that said, "Wow, this is just sticking out in my head that we something we can change"?
Yeah. So when you think about inefficiencies, I think a lot of times people automatically think about like machines or product and those kind of things, right?
Yeah.
But to me, it's the input you put in and how much output you're getting, right? And if there's a huge energy consumption but a very little output, that to me is inefficient. What exactly is that number? I think it's probably very variable by sector, I'm assuming.
Uh
But
huh.
to me, the amount of administrative burden, right,
Yep.
is one. The hoops that the hospital admin has to go through, the physicians have to go through, right? And then also we know you could still have a fantastic place, fantastic people in the rural communities, but still it's going to be hard for you to recruit because they want to stay in the city,
Yeah.
right? So now to think that I'm going to pay a provider or a specialist to come once a month or once every couple months, and we think that is an efficient way of providing care, absolutely not. There's still delays in care. There's still adverse outcomes in patients. And I mean, honestly, I was in here in Madison area, and I didn't know until some of my 80, 90-year-olds said, "Hey, you're going to take care of me at this hospital. I'm not going to cross that belt line." I'm like, "What is the belt line?" And that's our main highway. Like, like like to them, they did not want to be, transferred. So, anyways,
Yeah.
to me, efficiency is, you know, um, how you provide services, but also when you're able to provide it,
Speed
right?
to care. Yeah.
Yeah, so really be there from an access perspective, but then also efficiency to me is also from a quality perspective. You could still provide service, but is actually still a good service. Is this someone? I mean, the question I have myself asking every time: would I want my mother or father to be taken care of with me at this facility? And if the
Yeah.
answer is no, then well, the answer is no.
Yeah. That's amazing. That's amazing because you're uncovering a lot of things here. So let's just fast forward a little bit. So you start down the idea of with Beam, and what were some of the things that you wanted to start out trying when you came in with Beam? Well, first of all, explain Beam a little bit so we understand that.
Yeah. And before I get to it, let me tell, so the concept was, like I said, I wanted to leverage all these things to improve care in these hospital settings, right?
Yeah.
So that was the initial thing. The roadmap is always where what we become now. That was always on the roadmap. And I'll talk about it. But I think it would be really good for everyone to kind of hear. So, I was
Yes.
stalling or whatever you want to call it. I had all these ideas written down and working on things, working on things. It was July, I think June, July 2013. I was driving down to go to the hospital. Back roads of rural America, right? One
Yep.
lane this way, one lane this way. And I'm going this way. I see a SUV going hit the shoulder, and they overcorrect and they come right at me. And they literally miss me by like nanosecond or whatever, right? And I see this car just flipping in the back, in my mirror. So, unfortunately, I mean, I was the first one on the scene, and I'm
Yeah.
going and I'm helping the individual who unfortunately wasn't wearing a seatbelt and
Yeah.
passed away, in the middle of the street. But I was, working on her, doing CPR and everything. And, we had a bunch of bystanders who couldn't, they were shaking, they couldn't do anything. They tried to help, and then later on, just during that event, I heard a voice that screamed saying, Dr. Patel. What I found out was that individual that I was helping was actually the significant other of my hospital team member. You know, so
Oh, wow.
that story. The reason I want to say that is it was a near death experience. I go back to work, right? A few hours later, I'm attending meeting in some other hospitals later, etc. And I'm just looking at myself. I'm like, this all happened. I nearly died. You know, And the only thing I did was go to meetings while someone else just lost their loved one in literally those couple seconds.
Yeah.
And what did I have to show if today was my last day? Besides, yes, a guy who pursued his dreams and went to healthcare. Well, great, but like, how did I truly help the community? Like, what did I do for it? So to
Yeah.
me, unfortunately, like that was the wake up call that hey, get on it. You're either going to do something or not. So then, later 2013, early 2014, Beam started. And if I was to describe Beam as, um, we provide telemedicine virtual services as doctors, right, in rural hospitals and clinics, and also bigger hospitals and clinics now as well. But what we're providing general and specialty services to overall improve access, quality care, and just tackle health equity, urban or rural, doesn't matter,
Yeah.
right? I mean, that's the reason we have rural.healthcare domain from the get-go. That's why we have urban.healthcare as a domain from the get-go. Like that was always the plan, right? And if I was to explain what telemedicine is, I think everyone knows that now post COVID, right? But I think the one thing I want to make sure that everyone understands that in the hospital setting, we were taking care of patients, admitting them from the emergency room. So meaning I'm having this interview, I have access to an electronic health record, I'm putting all your orders in, everything, documenting, and I'm able to listen to your heart, your lungs, look into your ear, everything remotely. The most important piece in all of this, and I think people forget, is the patient interview. If
Yeah.
the patient feel heard, they don't really care if I'm on a robot or an iPad card or on the side because they feel that they're being heard, right? So, anyways, we're examining the patient, we're admitting them, putting them the medical floor, we're taking care of ICU patients. So we
Yeah.
started not with the cough and cold telemedicine, we truly started with complex telemedicine, right? Um, and once again, none of this is new. Beam does not get the credit for it, and neither
Yeah.
does anyone in the last couple decades, right? This is a 100-year-old thing. NASA, Lockheed, Indian Health Services back in the 70s tried a satellite-based telemedicine program,
Yeah.
right? There's teleradiology is one of the oldest ones. So,
Yeah.
anyways, it's just affordable and scalable now.
Yeah. That is incredible
Sorry,
because
long-winded answer.
no, no, it's awesome that you did it. It was awesome that you did it because, you're talking about being able to talk to me sitting in the middle of a small Montana hospital with a doctor that would never, well, highly unlikely would be working in that hospital in a specialty field that's giving me care that I can only get if I went to an urban setting someplace else and a special hospital.
Yep.
That's crazy. It's
Yeah.
cool. Wow, that's got to be incredibly fulfilling to be able to help these people that wouldn't have had that same help before.
Yeah. No, I mean, you know, I would say when we first started that whole concept, right? Going from like just providing services in person to that
Yeah.
back in 2013, 14. Um, Even half of our team wasn't ready. They did not believe in
Yeah.
it, and I don't blame them, right? So I absolutely don't blame them. And but the thing was, and I said, hey, whoever wants to do it, they could do it. They don't want to do it, that's okay. Just observe, and we go from there. So initially, me and one of my colleagues, we did like 90 days of mock drills before we went live. So it wasn't like we like, hey, here are a couple of robots or iPad carts or whatever, and we'll do
Yeah.
video conference and call it a day. But no, from an operational perspective, we needed to make sure it functioned well and the patient buy-in was there, nursing buy-in was there, and it was efficient. And what we found was patient buy-in was there from day zero. My first patient literally was a 90-year-old patient in the ER, and I roll in and she looks up there and she's like, "Is that Dr. Patel up there?" I knew her from before,
Yeah.
but her and I never lost connection. So she broke the ice on day one. And then I had another patient on the floor, some 50-year-old who had a stroke, and I got the MRI result. I went back and told her, and her and her husband, very well educated folks, they were visiting, and they said, "Hey, we would have never gotten a provider to come and tell us until maybe the next day or so,
Yeah.
right?" So, and having someone who's actually actively monitoring their data and coming and talking to them, they didn't care if I was on site. Now
Yeah.
that being said, if you're one of the doctors who are doing the electronic health record this side and not paying attention, like, that's not going to work.
Yeah. Well, that's it. I mean, when you think about the efficiency that you can provide healthcare, you doing it in a virtual setting, and it's got to be even compared to a doctor that's got to walk down the hall, go to the other whatever they're doing throughout the
Yep.
day. You've got to be able to do with the right assistance and everything else. You've got to be able to do a lot more quality care in a day than a doctor walking around a hospital.
Yeah, I think you nailed it. I mean, you have to be that much more efficient, but you also have to be that much more customer centered and quality centered.
Yeah,
I tell this to all of our new and current team members that we are in a hospitality business. We should not think anything different than Disney in terms of what the expectations are. And if anything, it's our job to make people feel good during their worst days, which is
yeah,
health, right? Like, so we're 100% of hospitality, and everything you do sometimes is, it could be magnified because you're remote, right? So yeah.
yeah. That's so. What are some of the things that, other than you said, people? I mean, they really are accepting of this. What are some of the other things that you found in doing this that you really didn't expect? You went, "Wow, that's cool," or "Wow, that's a lot tougher than we thought."
Yeah. Well, I'll tell you what was tough. I mean, the journey is always tough, right? I mean,
Yeah,
if things are simple, I mean, that's great. I guess I just never figured out the simple way of earning a fantastic, impactful living,
yeah.
you know.
I don't think
But
there is one.
yeah, I don't think there is one. There may be a good, opportunity businesses, but that's very different than a socially impactful businesses at times when you're trying to change a sector.
Yeah,
What I found, number one, I would say that was surprised was patient buy-in, because that was the thing I was worried about the most, right?
yeah,
Um, so that what you know took me by surprise. Then as the business evolved, also the healthcare sales cycle took me by surprise. It's very slow
oh
sales
my,
cycle.
oh my,
Meaning there are folks who are ready to adapt pretty fast, but then they have to go through so many hoops to get something approved, right? And then so that once again, inefficient sector, which I think it is getting better. Um, and the people in terms of my team, right? Some of these guys, they've been with me since day zero, right? They're still with me, like, and they initially moonlighted and now they're a
yeah,
cardiologist or infectious disease doc, but they all went through it and they were in it for the long haul. They want to be part of a mission of changing the sector, the delivery of care. I mean, they could obviously they have their full-time jobs. Some of them, for example, they don't have to do this, but they enjoy it. They want to be part of it, you know.
yeah,
So I think that to me, people have surprised me the most, which has been really good.
yeah, no doubt. So, what are some of the exciting things that you see now that you're going, A, efficiency wise or new technology that's really starting to help you go, wow, this is cool what we've got now, but maybe there's something that we've learned or something that we're seeing in the future that's going to be a step ahead?
Yeah. So first, I'll say the most exciting piece is still the people in terms of post COVID. Everyone's good with it. Doesn't matter the age anymore, right? Because then
Yeah.
everyone has smartphones, right?
Yeah.
So and no one wants to. Well, majority of the people, at least, don't want to go in person if they don't have to. They
Yeah.
still like seeing their provider in person, once in a while, but they don't want to go see them every single time. But don't
Yeah.
get me wrong, there are complex patients who need to be seen in person, right? Like not everything can be taken care of virtually. So, I don't know, about 5 years ago or so, maybe more, I can't remember. Um, I was asked during a panel talk in terms of what do I see as the future for healthcare?
Hmm.
It was always, providers, administration, leveraging tech and AI, right? And that time, initial radiology was leveraging AI on like chest X-rays,
Yep.
getting to like CT scans. Um, so instead of being defensive that they're going to take our jobs, it's saying, okay, how can I actually leverage this thing so I could expand more, right? And then also have some quality controls in place. I mean, to me, it was an automatic, and thankfully, I mean, the last year or two have been just so fantastic for multiple sectors. You know, so I would say that people's openness for tech, and now having AI, obviously, it's almost like the 1990s when you had www, right? Like
Yeah.
now we have AI. Like it just makes sense.
Yeah. Yeah. Well, we've got a client that does different kinds of occupational rehabilitation, and they're adapting it at a simple level, but just being able to summarize a whole lot of records together in these applications now with AI is a huge help in efficiency and quality of the summaries, because we have, if you got someone that's going through hundreds of pages sometimes and trying to summarize that, you just can't do it as well.
Right.
So when we get these complex kind of injury people in for the rehabilitation, it's really an interesting thing to watch how AI can think in so many different levels and put it together nicely for them.
Yep. Yep.
So
No, absolutely.
cool, cool. Well, now you touched a little bit on AI. What are some of the things that you see that's not working so well in technology right now? That's kind of a bust.
Yeah. And let me start right. Like first of all, I'm a techie first, physician second. Like that is
Yeah,
my
yeah,
start. So and that is all I read in terms of on a daily basis, right? I got plenty of smarter physicians who read all the clinical papers, right? So what's been great about tech, if it's telemedicine, if it's text messaging, right? Uh, if it's AI, that once again is providing access, right? Meaning physician to patient, but then also patient having various apps and things. I think FDA just approved a mental health app not too long ago, right? So I think it's direct to patient care is the access is significantly better. The
wow,
one thing that we're already running into is now healthcare becomes or the clinical service, the people part becomes a commodity, right? Meaning my time as a clinician is not valued as much. It's just who could put in the cheapest rate on an app, right? And now if we say all primary care, all specialists, etc., everyone's the same, and it's because this 19 bucks, 29 bucks, I'm just, giving you some rough ideas. This is where we get into a problem where we commoditize clinical services, right? And honestly, it's on us as clinicians too, right? What are we willing to go down to? Um, and so I think that's the piece that we need to kind of figure out a little bit, and then also patients don't really know if they're getting good care, okay care, great care,
yeah.
right? Social media reviews are fine, but that still isn't going to necessarily tell them if they're getting good care or not.
No, no. It's did the people that did the patients have a good experience or not, more than anything. Um, but you make a good point. If you're commoditizing the providers time and pay for that time, you run the risk of a reducing the quality of the providers because nobody wants to do it for that rate.
Yep.
Um, there's a lot of challenges with that. That's for sure. A lot of things need to be thought about that weren't even probably contemplated a long time ago.
Yeah. And so, that was one of the things that's been brought up to us, right? When you try to compare service to service or company to company, Beam has never been the cheapest and is never going to be cheapest, right? Because we
Yeah.
don't work with this commodity model where you're saying, hey, have a doctor who's covering 10 hospitals, right? And then we'll just pay per click. But that is exactly what you get. You get a
Yeah.
provider who's not dedicated to the community. You're a provider who doesn't know the nursing staff, doesn't know the community in general, right? Or the hospital workflows, etc. So, and our website actually just got updated, and I think on the bottom there's a video testimonial from one of our newer clients, and I think that's exactly what he talks about. I mean, we're in it from our accountability side, but we're involved at a multiple program level. Yeah, I mean, that's where we take pride in, right? Is the level of quality, and that's the
Yeah.
same thing if we transition to Teams by Beam, which is our direct to employer,
Hmm.
service line. It's at the same mentality, right? It's based on the big picture of quality, not simply just providing the cheapest access.
Yeah. Well, let's talk about we didn't talk in detail about Beam. Give us an overview of Beam, and then I want to also talk about Teams by Beam and Flow. You got a few things going on, so it'd be cool.
Yeah.
But first of all, Beam Healthcare. What are you guys doing there?
Yeah. So Beam Healthcare provides, telehospitalist and telespecialty services, as well as some of their newer service lines like telerespiratory therapist and tele case management, etc. But it's basically a comprehensive line of clinical services that we're providing to healthcare systems. So this is B2B, right? So
Yeah.
we're the doctors or we're the respiratory therapists, etc. We're providing virtual care to these rural hospitals, community hospitals, and also, we've also done a clinic for Mayo, right, for a full-time tele-rheumatology clinic. So,
Wow.
but we are the providers, and we provide the clinical services instead of me being there on site. The only difference is we implement a program to run it all virtually, right?
Hmm.
But simply put, those are all the different service line in the hospital we provide, and then we provide like outpatient teleclinic. So let's say you needed a heart doctor or infectious disease doctor, or for your COPD you needed a lung doctor. You don't have to go see someone in the big city. They would have you go to your local clinic. They'll still do your triaging, everything else, but you're just going to see the provider virtually.
Yeah.
They're reviewing everything just like they would on a normal visit,
Yeah.
and you didn't have to make that 2-hour drive.
Yeah. That's incredible. That's incredible. I mean, there's so many cases where that can be. Well, first of all, the drive itself can be difficult for the patients, but just the inconvenience of it too, and not having to do it, it's so much better for the patient and the provider.
Yep,
Uh,
absolutely.
huh. So then you talked about Teams by Beam. What are you doing there with Teams by Beam?
Yeah, and actually, I forgot. Before we jump into that, I should probably mention, like, the whole reason I went into healthcare, like I said, was socially, it was something close to my heart, right?
Yeah.
During COVID, obviously, we saw what the community needed, right? During that time, our team, we set a bunch of telemedicine programs, a bunch of different community hospitals to support their primary care doctors or their hospitalists with our specialists, our respiratory therapists to help with now the COVID patients that are in the ICU, etc. So this way
Hmm.
they weren't alone. That wasn't a business model for us. That was all we volunteered. The whole team volunteered for a year and a half, right,
Wow.
to make that happen. During that same time, when I went to Tijuana, and one of the colleagues of mine, he had a nonprofit in Tijuana, and there was 4 orphanages that were not getting any healthcare during the whole COVID. So we set up the telemedicine programs for them with the iPad cards and through our nonprofit called Beam Up, and and we had local providers who volunteered. The kiddos got access to healthcare during COVID. About 120 or 140 kids, and there's no doctor or nurse over there, right? So it had to be easy to use the
Yeah.
stethoscope, everything, ear infections, like how you could use that tools, all the tools we choose, we're not here to make money on tools, right? Like, but everything's so easy now. So I just wanted you to know that we started on the B2B side, enterprise, and all these things we talked about. But then we implemented during COVID on our nonprofit side, and there are videos on beamup.charity that you could take a look, and our goal is, and then also we, I think, helped in Papua New Guinea during that time with some echocardiogram readings and those kind of things,
Wow.
but that's kind of the whole reason I kind of started. We were able to now saying, okay, where I started my career, it just took about 20 years to prove it, right? Like the
Yeah.
mission I had in 2003 or whatever.
Yeah.
Yeah.
Yeah. So, yeah. So you're like 20 years, and we talk about perseverance, persistence, and the things you've had to do to get here to be able to do this. It's just really something.
Yeah.
Do you ever just look back and go, wow, I don't believe we made it this far?
I wish, I don't know if I say I don't believe it. I think I always believed it. Well, actually, I shouldn't say that. I don't think I never not believed it, right?
Okay.
I just kept at it and kept going. I think one thing you realize is, and everyone needs to realize, that no one is going to care about your mission and your vision as much as you do as a CEO, as a founder, right?
Yep.
And others shouldn't care more than you. Like they shouldn't,
Yeah.
because that means there's something wrong with you.
Yeah. Didn't be in
But
business then. Yeah.
yeah, but no, I mean, I remember when I started, you know, starting Beam from scratch. And during that time, I started a retail store for my family. So Monday through Friday, I was a physician. Friday, Saturday, Sunday, I was a cash register and bathroom cleaner, right? And I was starting from scratch, and that I started from scratch. Bank balance was less than 5 grand, not knowing if I could pay my medical
Yeah.
school loans the next month, or my house mortgage. My accountant told me that, hey, you are a director. Why are you doing all this? And I knew he was a nice guy, but not my accountant, right?
Yeah.
So I changed. And so I just wanted you to know, I think it was never that I didn't believe in it, or I believed in it too much, that saying I just stayed the course. That's pretty much it.
You had a vision and you knew where you wanted to go and you were going to go there.
Yeah.
Yeah. That's cool. So now the teams by Beam, you're helping these healthcare facilities with full-time people. Is that what it
Oh
is?
no, Teams by Beam is a direct to consumer
Oh,
healthcare subscription, right? So this is meant for the non-healthcare folks.
oh,
So this is for either individuals or really focus more on the employer. So, construction company doesn't matter, right? Remodeling company or consulting company doesn't matter. But this is for businesses who
okay.
want to provide healthcare access, quality, whatever you want to call it, right? Outside of the usual way. And we're not an insurance; we're a medical membership subscription. Sorry. But that's really what it is. And my goal was always, once we prove it on B2B side and it's affordable and scalable, which thankfully post COVID, all technology has been pretty much,
Yeah.
so I think everyone could afford it.
Wow, that's got to be popular in the privately insured companies to help keep costs and care quality high and cost reasonable for them.
Yeah. So right now I think Teams by Beam, I would consider that to be at its infancy.
Hmm.
We're figuring it out, right? And for me, it's always been, don't decide what the market wants or needs. Listen, and then not pivot, but just restructure as needed, right?
Yeah,
So we've
yeah,
been doing beta testing for, I would say, probably about 2 years now with it, right? But long story short, if you go to our website, which is teams.healthcare, um, there's a subscription that starts at 2,500 bucks, for example, right?
yeah,
Obviously, don't quote me on the number. That could very well change when someone
yeah,
views this. But anyways, um, but the whole concept of that is, and initially we started, there's this per member per month, right? Kind of thought, which
hmm,
is good. I think that's good for direct primary care and those kind of things. If you think about a business, and I'm thinking about myself as a business,
yeah,
what would I buy? Like, am I going to buy Teams by Beam for myself, right? Like for the company, right? There are companies who can't afford the traditional insurance. There are companies like us who do have insurance, but we still don't like the access and the hoops they make us jump through.
Yep.
But it's
Yep.
still, we need that, hospital, cancer, and all these other stuff. Is there still value in it? So what we made Teams by Beam is, it doesn't matter if you have 10 people, 25 people, 50 people, or 75 people. It doesn't matter to us. You start at 2,500 bucks, right? In return, what you get is you get access to, primary care, like myself, for example, right? To do routine visits, a mini
Yeah.
sore throat, cough, cold, those kind of visits. You get access to mental health for through BetterHelp, who's one of our partners in there, our collaborators. You get access to a lot of the generic meds, and we have a collaboration with Mark Cuban, Cost Plus Drug Company, right? And then if you think about a lot of these different services, clinical service, text messages back and forth, prescriptions, mental health, wellness, and those kind of things, and ongoing education that we send out. We know that, like, for example, you as an employee, your needs may be different today versus a 20-year-old in the company,
Hmm.
right? Some people want more mental health. Some people may need more of the prescriptions. Some
Yeah.
people may need more services during the winter months with their kids, right? And
Yeah.
everything else. So the utilization from a business side, I mean, you just don't know. It's going to be all over the place, right?
Yeah.
And what we are based on, the 2,500 bucks gives you access to multiple different services. So it's not per member per month. And if you use a lot of it, then you just go to the next tier up, right?
Yeah.
So this way you kind of know what you're providing. You're providing all the suite of services for all you guys. And if they use it, great. You could always go up. If they don't use it, you're not breaking your bank,
Yeah.
right? And
Yeah.
then the other thing I didn't mention, you're able to order blood tests on your own, right? So if you need to go get your basic kidney, liver,
Yeah.
anemia, and all these stuff, thyroid checked, it's gonna be less than $100 for you to just go ahead and order it and go get it done.
Wow. Wow. Yeah, that's incredible. That is super cool. I'm glad we got into that because I think, in my work, I see that healthcare. I mean, you just look at traditional healthcare over the course of the last 20, 25 years. The costs have just continued to gone up, and people, pay the 10, 15%. It goes up every year. That's just the way it is.
Yep.
And employers and the employees just bear the brunt of that.
Yeah.
But this kind of care is, I gotta believe, in the situations where you start out doing it, they've had some pretty good results, or pretty good happy people.
Yeah. I mean, and I could share some stories, and I think we have it on our website for that too. You
Yeah.
know, one of our or one of the employees, the CEO, who's one of our first beta clients, calls me saying, "Hey, Fritz is not feeling good. He's dizzy. He's got a headache. He's bleeding from his nose." I'm like, "Hey, why don't you go ahead and take his blood pressure and everything else?" We had that little iPad thing at his place too, right? So did that. I did a visit with him. His blood pressure was like 190 or 120. Okay.
Mm.
So it wasn't the higher number, it was the lower number, 120, that was very high,
Yeah.
right?
Yeah.
And I said, "Hey, you're gonna stroke out. You need to go to the hospital. Like, this is not something I should be managing over here. Like, this is someone, if I saw you in the ER, I would admit you for a day or two, you
Yeah.
know?" So he's like, once again, insurance is of concern. Like, don't want to do it. Right. So we called in emergency medications at a local place. And thankfully, since that time, his blood pressure has now been in the 140s. Now he gets all of his medications for COPD, for his cholesterol and everything. And I could say this because he has shared and he's got a video on our site. And, also the other thing is, I think people don't realize one of the highest risk from a mental health is our blue collar workforce men. You
Yeah.
know, well, they feel like they have to be the man, man of
Yeah.
the house. They cannot show emotion, right? They
Yeah.
have to be strong, and that's how they were brought up. The problem is you bottle up so much,
Yep.
right? And it's horrible for your health. And
Yeah.
I think letting folks know that it's okay for big guys to be vulnerable, right? Tough guys
Yep.
to be vulnerable. And I think that's also, so that they, not they, in terms of like that population is more open to using mental health or just reaching out and just talking about these things. And I think that's the part that gets missed when digital healthcare becomes a technology commodity only. You
Yeah.
know, people will always be part of healthcare.
Hmm.
100% I'm going to leverage AI and tech wherever possible. But the connection we make, the hugs you're able to give, eventually when you meet in person, like for example, this direct to consumer, depending on the size, we make some on-site visits, right?
Hmm.
Goes a long way.
Yeah. Yeah. Man, this is so cool, Sergio, what you guys are doing. Um, man, I'm just so thankful we were able to talk with you today. If if people have questions about Beam Healthcare or companies want to talk to you about Team by Beams, is there a contact form on your website, or what's the best way for them to get
Oh,
a hold
just
of
LinkedIn me. I think it's probably the
you? Okay,
easiest thing to do. Yeah.
very good.
Or-
And
Yeah.
we'll have that in there, and you're mentioned in the tagged in the post, and I'll make sure I get that in there. Um, Thanks so much. I mean, wow. It I am just super excited that we were able to talk to you today, learn more from you. And man, you're just an inspiration in this. I know this has been your thing for a long time. You're like, oh, it's not just a big deal. I've been, I've been plowing at it for a
I
long time,
appreciate it.
but it is cool, dude. It is cool. So just thanks for being here today. I also want to thank the people that were listening and commenting and everything else. Love that you're there. Love putting the comments in. Thank you so much for that. We'll be back again later this week. Sergio, just hang on for a moment. We'll finish up after we're offline. Thank you.